Violence, Injuries and Disability Unit at the WHO Regional Office for Africa. Dr. Retis, thank you for joining us. How are you this Tuesday?
Good morning. Thank you for having me.
Our pleasure. So now that the Lusaka session has started, why is rehabilitation such a pressing issue for Africa?
Thank you for the question. So, in Africa, it is estimated that over 210 million people are in need of rehabilitation services due to various conditions. And this number is increasing due to the population aging and also due to the lifestyle changes in the continent that lead to more chronic conditions and non-communicable diseases like cardiovascular diseases and diabetes. There are also still a high number, of course, of people affected by communicable diseases like measles, polio, and other outbreaks that come with some complications sometimes and long-lasting impairment. And also, there is a high prevalence of injuries in Africa, for example, due to road crashes, but also to violence. So, all these conditions can cause a loss of physical and psychological functions. And this is where rehabilitation comes as a useful service. So we are talking about 1 out of 5 people in the continent, from children to adults and older people.
At this session, health ministers are endorsing the 2025-2023 regional strategy for rehabilitation. How will this strategy change access to services?
So the strategy gives a lot of emphasis to political commitment, so asking member states to improve, strengthen national policies around rehabilitation, allocation of resources, to integrate these services at all levels of care. And so this requires also efforts to strengthen capacities of the workforce at all levels of care, from the community to the specialized hospitals, for example, and to improve the availability of data so that needs can be tracked and the response can be designed accordingly in all countries. And of course, more research and more innovation.
What role will the governments and communities play then in making this strategy a success?
So the government, as we said, they need to make efforts to design policies that integrate rehabilitation and to invest in developing such services. They need to do this in collaboration, of course, with other sectors, with social welfare, and with civil society organizations in the continent. Currently, there are a lot of community-based organizations who are close to individuals who need rehabilitation, people with disabilities, and that do a lot of work already in the ground. But it is these two levels, so the grassroots and institutions, need to come together and work together to increase timely access to rehabilitation for all in an affordable manner.
So, what key message would you like African communities to take away then about the importance of rehabilitation? I know you touch on one of the barriers or contributing factors to this not getting as much attention as it does is that the population, the aging population, is increasing on the country. And we know that a majority of our population is young people. So maybe governments might not take it as seriously. But what message would you send to African governments on rehabilitation and how this needs to be taken seriously?
Rehabilitation is a set of services and that can really improve the functioning of people. So becoming again active member of the society, regaining autonomy, and also recovering dignity as active member of society. So politicians and ministries of health should really understand that, yes, we do need to work on reducing mortality, reducing morbidity, so health conditions they make us sick, but also we need to make sure that people thrive and that they have a good quality of life despite the presence of an impairment.
Dr. Retis, thank you so much again for your insights and for educating us on an important matter. We appreciate your time.
Thank you.
That's Dr. Chiara Retis from the World Health Organization's Regional Office for Africa, emphasizing the importance of rehabilitation within health systems and how this needs to be strengthened on regional and continental level strategies. It's just gone, or just before 7